Key programs across the country that detect and respond to public health risks are in jeopardy.
And according to a report released today, state and federal budget cuts are to blame. News 8's Jenna Traum joins us live in her studio with a look at how La Crosse's emergency response capabilities are taking a hit.
Mark and Lisa, La Crosse emergency and health officials tell me the county is feeling the deepest cuts in training for public health emergencies. And that means emergency responders are going to be less prepared for future disasters. La Crosse County Emergency Management Coordinator Keith Butler is getting anxious.
The trend has not been very positive at all.
His budget from the county has not been cut, but the funding and grants he gets from the state and federal government have been, and that's translating into less training for emergency responders.
Maybe do fewer exercises or the magnitude be a little bit less. The training certainly is going to have to be cut back, and that's unfortunate. Because without training for the new people that come on board and refresher training for the folks who are already on board, because programs can disintegrate.
It's a trend the director of the La Crosse County Health Department is seeing too.
With less resources, we just haven't been able to provide that same level of training and same level of preparedness that we have in past years.
With less money coming in, they had a choice: cut back on day-to-day operations or on emergency training.
The trade-offs are either to prepare for a potential emergency or to provide direct services on an ongoing basis. And without the federal funds and the state funds, we've opted to do less preparation and continue to provide the direct services.
And as Butler looks at his future prospects for training, he worries his office's emergency response plans will become just another manual on the shelf.
Now what are we going to do? Who's going to pay for that? I don't know. I really don't know the answer to that.
Both emergency management and the health department tell me funding for preparedness training spiked in the years following 9/11. So they're better trained now than they were a decade ago. But since the economy began its decline, much of that funding has disappeared.
Thank you, Jenna. If you'd like to check out the report yourself, you can find it on the Trust for America's Health's website at healthyamericans.org.